What is this fear that people have? Cancer शब्द सुनते ही they feel like it's end of the life.
Back in those days, moment cancer is diagnosed, yani it's a death sentence.
Is it possible to increase the life expectancy?
Yes, it is possible. When you talk about life expectancy, a term that we frequently do not use because there are several factors. There is this misconception that cancer फैल सकता है, which is absolutely wrong. So cancer is not contagious. It's not like COVID. It is a genetic disorder. It's like diabetes. So when diabetes cannot spread by sitting next to each other, then how can cancer?
So when we talk about blood cancer, and now that the number is not a small number, if we look at it, so what could be risk factors कि इतने numbers बढ़ते जा रहे हैं when we talk about blood cancer?
So unlike other cancers like lung cancer, where you have a very strong risk factor, that is tobacco in that case, blood cancer is not driven solely by lifestyle.
नमस्ते एंड स्वागत है आपका हमारे शो बियॉन्ड द पिल में, और मैं हूं आपकी होस्ट डॉक्टर चेतना। और आज के एपिसोड में हम एक ऐसे टॉपिक के बारे में बात करने वाले हैं विच टचेस मिलियंस ऑफ लाइफ, विच इज ब्लड कैंसर। और हमारे साथ हैं डॉक्टर फहाद अफजल। ही इज द लीडिंग मेडिकल ऑन्कोलॉजिस्ट एट जसलोक हॉस्पिटल, भाटिया हॉस्पिटल एंड सैफी हॉस्पिटल। इन्होंने अपनी लाइफ कैंसर पेशेंट्स की ट्रीटमेंट और क्योर को इम्प्रूव करने में डेडिकेट की है। तो आज इस एपिसोड में उनके साथ डिस्कस करेंगे कैंसर के अर्ली सिम्टम्स के बारे में, ट्रीटमेंट ऑप्शंस के बारे में, और कीमोथेरेपी का क्या रोल होता है, और कैसे पेशेंट्स एंड फैमिलीज विद होप एंड स्ट्रेंथ इस जर्नी को फेस कर सकते हैं। तो चलिए शुरू करते हैं ये इम्पोर्टेंट कन्वर्सेशन। सो हेलो डॉक्टर एंड वेलकम टू आवर शो विच इज बियॉन्ड द पिल। And the whole idea about having this podcast and this theme is that कि हम लोगों को we want the right information, right awareness to flow in the media. And from great names like you, we want to help our population and educate them and really give them good insights about all the treatments and all the myths and everything which people could get about cancer.
Thank you. That's a very noble initiative. And I think it's the need of the hour.
Yes.
Because there's so much of misconception that is there rampant in the society that I feel it's, oncologists like me, it's our responsibility to dispel those myths and misconceptions.
True. And उसके ऊपर कैंसर, this disease, this condition, एक ऐसी like there are n number of conditions, but when we talk about cancer, there's a different type of fear, there's a different type of misconception, there's different type of information which is flowing in the social media right now.
And even in our training, we are taught that cancer does not affect a patient; it affects the entire family.
Yes, that's
so
true.
It's overburdening for the patient in every sense, as well as for the primary caregivers.
So just to start with, I would not like to go into the deep about what is cancer, but I want to address ki what is this fear that people have? Cancer शब्द सुनते ही they feel like it's end of the life now.
So this goes back in the early 1900s when cancer was a very dreaded disease. Back in those days, the moment cancer is diagnosed, yani it's a death sentence, सज़ाए मौत. Things have changed, but that perception has not changed. That fear that now there's nothing, it's the end of life, and now it's more of how well we can plan our end. That's what the notion is still there in the general public, but that is wrong. There has been a lot of advancements in the last 20-30 years.
Right.
We have newer modalities of therapy like immunotherapy, bone marrow transplant, CAR T cell therapies, which has revolutionized the way we look at patients with cancer. So I think that is what should be communicated to the society, that in our practice, I have patients who have been diagnosed when they were in school, and they ended up graduating, they got married, they have children, and they're still following up with me, and it's close to 10-15 years now.
That's beautiful. And then, so what do you think with such recent advancements? Is it possible to increase the life expectancy, and is it possible to get that quality of life back as it was before detecting from cancer?
Yes, it is possible. When you talk about life expectancy, a term that we frequently do not use because there are several factors that is involved in life expectancy. For us, survival and the quality of life. These are the two very important parameters. So mere improving the survival rate but not looking at the quality of life is not what we want. So now in the last few years, as I said, there are a lot of newer advancements in oncology where the lifespan, the survival rates have improved tremendously while maintaining the quality of life. When I say quality of life, it means they should be able to work and lead the life which they lived, prior to diagnosis.
Correct. So I have seen I've seen my close family also getting, like people are getting, समझो अगर किसी घर के बुजुर्ग को कैंसर या किसी पेरेंट को कैंसर डिटेक्ट हो जाता है, आजू बाजू वाले रिलेटिव्स आके बोलना चालू कर देते हैं कि अभी बहुत कम लाइफ बची है, सो माइट एज वेल जस्ट गेट मैरिड, या फिर कुछ भी उनकी आखिरी इच्छा है तो वो पूरी कर लो, या उनके रहते अपना सब कुछ सेटल कर लो. सो हाउ डू यू चेंज दिस माइंडसेट, एंड आप इस सब से कैसे डील करते हो?
So when you say, some people say कि शादी कर लो, we also see patients जिनकी शादी पक्की हो जाती है और डायग्नोसिस के बाद में बोलते हैं अभी शादी, आप just cancel the alliance which has been created. So a lot of social
Stigma
behind it, and that is all stemming from the fact that cancer yani, it's the end of the life. So I feel more than the survival and the response rates, the financial factor is a major challenge, especially in India, where most of the patients are uninsured. There are some medicines which are available at an exorbitant price. So that becomes a major hurdle for treating patients. So if you are able to overcome the financial toxicity, we call it financial toxicity, like how medicine has its side effects.
Yes.
This is a major side effect of cancer, the
Yes.
financial toxicity.
Yes.
So that if we alone, the doctors alone cannot make a big difference, but we need the government, the regulatory authorities and all that. That will make a major difference in patient's acceptance towards the treatment part.
Because when we talk about cancer, matlab, it takes a toll on physical body, that's for sure, but then it is dread. Matlab, people fear it kyunki, as you mentioned, financial toxicity, like the term you coined, and then there is mental health getting disturbed, the family is getting disturbed. So like अगर किसी को कैंसर को रियली हराना है, so they have to be really mentally strong. The family has to support the patient in a way कि you'll overcome and you are going to win from it. अगर ये सब नहीं होगा तो I don't think कैंसर को बीट किया जा सकता है.
Yeah. So it's physical, mental, financial and social. These are the 4 aspects that we always cover during our consultation, especially for a patient who's been recently diagnosed with cancer. Physical involves the side effects associated with therapy. For example, if it's a head and neck cancer, which is the most common cancer in India, at least, surgeries are very radical. They remove half, of your face, and एक इंसान की पहचान उसके फेस से होती है. We identify them कि this person has come because by looking at the face.
Right.
So by losing the very identity, that brings down their confidence. That's the physical part. Mental is whether it's intimacy or whether it's their work life, everything gets affected because they lose their confidence.
Correct.
So financial toxicity, as I said, whatever savings they have, which they've kept for some other reasons, planning a good future ahead, gets all used up, utilized in this unexpected expense that has suddenly come up. And social, we have patients who say that when they travel, other passengers hesitate sitting right next to them because there is this misconception that cancer फैल सकता है, which is absolutely wrong. So cancer is not contagious. It's not like COVID. It is a genetic disorder. It's like diabetes. So when diabetes cannot spread by sitting next to each other, then how can cancer
That's true.
spread?
That's true. See, now we talk about this disease. There is so much of sadness maybe surrounding it. There's negativity, and I mean, as a doctor also, for you it must be becoming very challenging, when you're going home and you feel कि इतना सारा negative चीज absorb कर लेते हैं. So what made you choose this field and become an oncologist?
I'm glad you asked this question because that is what even I perceived prior to getting into oncology. And I had an option of become a cardiologist or a lung specialist. I spoke to several oncologists before taking up oncology as a career, and they all said, no, there's nothing like that. There's absolutely no negativity, no sadness, no grief. Of course, we have patients, terminally ill patients, a lot of pain, suffering, but in the end of the day, when you treat them and they get better, that positivity overcomes everything that you have seen otherwise, in the course of the day. And now that I'm an oncologist, I totally agree to that. So, I mean, you can notice it by being around the vibe. We have patients who are so happy. We have regular programs. We have patients who have been treated. They come together. We celebrate. We have awareness months. Almost every month there is an awareness month. For example, now it's the blood cancer awareness month, where we call survivors and they come share their experience, and it's just a jovial atmosphere that there's nothing left. I mean, of course, I wouldn't say it's always that case. We have the other side of it also, where there's a lot of pain, intractable pain and all that. But that is manageable.
Okay. And then where can people find you?
So I practice primarily in South Mumbai. I'm attached to Jaslok Hospital, Saifee, Bhatia, Wokat, Masina. I have my own center in Tardeo. It goes by the name of Ascure Center of Oncology, where we treat patients from all strata of society at an affordable cost. For me, financial toxicity is something that I have to keep in mind
Yes.
while treating any patients.
Yes.
We have tie-up with several government schemes, yojanas, where we are
Mhm.
able to give patients who are eligible for these yojanas, we are able to treat them at a fraction of the cost which otherwise
Okay,
would be there.
okay.
I have my outreach clinics far beyond Thane, Mira Road, Jogeshwari, Kurla, where I
Wow.
regularly, yes, yeah, where I visit once in a week or once in 2 weeks. Sometimes even beyond Bhiwandi, almost touching Pune.
God.
Yeah.
You are everywhere now.
Yes.
Like as you mentioned, we have a blood cancer month coming up, right? So on this event, we have planned this podcast. What is the prevalence right now in India? I mean, how many patients do you see?
When you talk about blood cancer is not one disease. It comprises of three important diseases, namely leukemia, lymphoma, and a condition called myeloma. So if we club all these together under the
Okay.
title of
Okay.
blood cancer,
Okay.
it is undoubtedly among the top 5 cancers that we see in practice. So in a month, see close to 15 to 20 cases of newly diagnosed blood cancer, and of course the ones which have been following up with us. So I would say 30 to 40 patients per month of different types of blood cancer, ranging from the most indolent, the one which is very, very slow growing, some cases which do not require any therapy at all. Just close monitoring is what is advised.
Oh.
We have that kind of cancer, blood cancers, and the other end of the spectrum where each day, each hour counts, the acute leukemias, where urgent admission, urgent chemotherapy, emergency care, that also comprises of the
Okay,
practice that we
okay.
have.
So when we talk about blood cancer, and now that the number is really, I mean, it's not a small number, to be, if we look at it. So what could be risk factors ki itne numbers बढ़ते जा रहे हैं when we talk about blood cancer?
So, unlike other cancers like lung cancer, where you have a very strong risk factor, that is tobacco in that case, blood cancer is not driven solely by lifestyle. So, we have children. In fact, right now I am treating a 1-year-old with blood cancer.
That's
So,
sad.
what has that 1-year-old done? So, I mean, there's nothing which that 1-year-old did was wrong, and that is the reason why
Yeah.
he had a blood cancer. So, most of the cases are genetic in origin. That means they're beyond our reach. The reason why the numbers are increasing is because of better diagnosis. So now we are able to diagnose what was not diagnosed, say 10 years back, is now being diagnosed. We have the name of the disease readily available, and that is the reason why the numbers seem to be increasing. But it was always there. Back in the 70s, back in the 80s, lymphomas, leukemias, myelomas were still there, but we were not able to diagnose it.
So when we talk about it, the symptoms part of it, unlike other cancers which shows tumors or some inflammation, या फिर there is something on the skin which is
Yeah.
noticeable. And when we talk about blood cancer, and especially if you are mentioning कि बच्चों में, how can one understand कि ऐसे symptoms हो रहे हैं and there could be a chance of having a blood cancer?
That's right. So oncology is divided into solid tumors, where there is a visible or a mass deep seated inside the body, and the other field in oncology is hematological malignancies, that is the blood cancers. So leukemias and myelomas have no mass. There's nothing palpable. In some cases, there may be lymph nodes around the neck, armpits, groin, but in most of the cases, the symptoms are very vague, non-specific, like weight loss, fever, repeated infections, bleeding, and there are so many other conditions where these symptoms may come up. And that is one reason why these diseases get diagnosed very late. Because patients with a history of 2-day fever, one may think of more likely causes
Yeah,
like malaria,
correct,
viral
correct.
infections. But it's only when these causes are ruled out that one starts suspecting blood cancer.
So it has to be like a chronic.
That's right, yes. So we get cases from MD physicians, from general practitioners, where they have tried everything to evaluate. Either they have not found an answer, or during that evaluation, it has been found that there were some, leukemic cells or any features which are suspicious of blood cancer.
तो आपको क्या लगता है कि is it only because of the patients who are coming to the doctor late, or it could be because of the physicians or MD who are not able to detect it and route it to the oncologist?
So both the factors are there. Patients, because most of these lumps, especially in solid tumors, most of these lumps are painless. And in our society, if there's a lump which is painless, there are still females who feel that if it's not hurting me, then it shouldn't be a problem.
Correct.
So that's where the problem happens. We, as an oncologist, I feel relieved when the patients start complaining of pain, because I know it's an
Yes.
infection, or it could be something which
Yes.
can be
Yes.
managed at the
Yes.
physician level. It's
Correct.
only the painless lumps which are the worrisome ones. Similarly, for blood cancer, a fever which is not settling for weeks together, even after taking multiple courses of antibiotics, unexplained weight loss, tiredness, which is again not explained, low hemoglobin, which is called anemia, and the anemia related symptoms like tiredness, shortness of breath. And despite the standard medicines that are given for it, still these symptoms are persisting, should arise a suspicion of blood cancer.
सो इट ये तो एक पेडियाट्रिशियन, जैसे अगर बच्चों में ब्लड कैंसर की बात हो तो एक पेडियाट्रिशियन का बहुत बड़ा रोल है टू अंडरस्टैंड द सिम्टम्स एंड टेक द इन्वेस्टिगेशन फर्दर. सो व्हेन वी टॉक अबाउट डायग्नोसिंग इट और स्क्रीनिंग इट, what are the tests or what a patient is supposed to do?
So in blood cancers, because it is affecting the blood, the primary investigation is a blood test. Okay?
Blood test.
And in that blood test, I'm sure you must be aware of it, there's a test called CBC,
Yes.
a complete blood count.
Yes.
So in many leukemias, which is a part of blood cancer, the diagnosis can be established on the basis of a CBC alone.
Okay.
There are some abnormal cells in the WBC group which are called blast, and the presence of these blast is diagnostic of blood cancer, that is leukemia.
Okay.
Of course, we require further advancements like bone marrow in biopsies, bone marrow aspirations, at times a CT scan, especially for lymphomas, to see if to confirm the diagnosis, to know the subtype of the leukemia, to know the extent of the disease. So these are the tests that is required in order to diagnose and stage it. Once the diagnosis is confirmed, the next question is to stage it. Conditions like lymphoma have a stage where it tells us how far it has spread. If there's a lump around the neck, whether it has gone to the liver, whether it has gone to the bones, whether it has reached the bone marrow, these can be confirmed only with the help of imaging scans like CT scan or something newer called PET scan.
When we talk about the screening part is done, ये होने के बाद when we come to the treatment part of it, so now I really want to emphasize more on how, we all know कि when we talk about chemotherapy, when we talk about radiations, cancer is more fearful because of the treatment.
True.
जो ट्रीटमेंट के साइड इफेक्ट्स होते हैं, people think कि अभी it's like gone. I've started taking chemotherapy, they start isolating themselves and the whole quality of life goes down.
So in oncology, there are three broad specialities. There's medical oncology, wherein the physicians, with the help of any medicine, they treat the cancer. Then there's radiation oncology, where with the help of certain specialized X-rays, similar to the X-rays that we take, but these are very specialized X-rays which helps treat the cancer. And then there's surgical oncology. Now that we're talking about blood cancer, there is absolutely no role of surgery, needless to say.
Correct.
So that leaves us with two options, that is medical oncology and radiation oncology. Major misconception is that medical oncology is all about chemotherapy. Of course, chemotherapy forms the backbone of cancer therapy, but it is not the only treatment. There is something called immunotherapy, which are drugs which augments the body's own immune system and programs the immune system to kill the cancer cells.
Okay.
Then we have targeted therapy, which, as the name suggests, that it is focused on certain genetic mutations that the cancer cell has, and the advantage is that there is minimal damage to the normal healthy cells surrounded.
Okay.
And then there is radiation therapy, which is reserved for cancers like lymphomas, where there's a proper swelling, that is an enlarged lymph node, where radiation is guided to shrink the mass and consequently improve the survival.
But then, as you told me about the 1-year kid going through a chemotherapy,
you're still thinking about that 1 year.
I am all stuck there. Ki how itnu sa bacha will be taking chemotherapy, and what parents would be going through, and how can they be really strong and face it and fight it, because the kid or anyone, because blood cancer we know कि बच्चों में बहुत ज़्यादा होता है, तो how can they fight it out, because पूरी जिंदगी पड़ी है बच्चों के सामने अभी.
So that's where survivorship comes up. I'll be speaking about that in a while. A major challenge in treating such young children, 1-year-old, 2-year-old, is the communication gap, because I can't find out if they are in pain, if they're crying because of a headache or an abdominal pain. I always have a qualified pediatrician with me to address these problems. But communication is a major problem in these patients. Adults can go at length explaining their problems and everything, their mental stress, but I cannot expect the same in a 1 or 2-year-old, or even a 5-year-old for that matter. Another challenge is the IV access. These kids should not be pricked time and again. So we have to use certain specialized IV access devices which ensures that we don't have to prick them throughout the course of therapy.
So what do you do for it?
So there is a special line called a PICC line.
Okay.
This line
Yes.
looks very similar to a IV line, but the advantage of that is for any blood test, all we need to do is just open the PICC line, and even if the kid is sleeping, we can collect a sample without waking up the child.
Okay.
And then we have ports. Ports are surgically implanted small devices the size of a button, and it is placed below the skin. And that again gives an advantage that the patients need not be pricked time and again. And prolonged infusions, medicines which go on for hours or days together, can safely be administered without the need for IV lines in the hand or in the feet.
So what are the major challenges which you see during treating such patients, or you see कि family face कर रही है ये सब चीजों में during the treatment journey?
The fear of the disease coming back, because whenever these diseases come back, they come back with a vengeance. They come back more stronger than before. The same medicines which worked in the first line do not respond in the second line, and we need to change the therapy, go for more aggressive therapy. These therapies may not be available in the country. We need to import certain medicines. The cost goes up, and there is this unpredictable nature whether this will really help or not.
Okay.
So that fear is there whenever we treat, not just with the family, even as a physician. Relapse is something that we dread. That's why most of the diseases, even after the disease is not detectable on scans and marrows, the treatment still continues for some period of time.
Okay.
To ensure that the chances of the disease coming back is reduced to the minimum.
And then when we talk about this blood donations or bone marrow transplant, which is highly used in treating blood cancer, so what is your take on this? Ki how much is it effective, and abhi ke time pe how many doctors are really doing it?
So I'll answer that in two parts. One is the blood donation. So blood donation is a very, very important thing that we should focus on while treating blood cancers, because most of the treatment that we give for blood cancers leads to a drop in the hemoglobin and the platelets, for which we have to resort to blood donations. And the only way we can get donation is by voluntary donors. As we know, it's not like a medicine which has to be manufactured. Blood donation is purely on basis of voluntary donors. When you talk about bone marrow transplant, certain types of leukemias, certain types of lymphomas, and most of the myelomas require either autologous or allogenic bone marrow transplant. When you talk about autologous, without sounding too technical,
yes,
autologous is when the patient donates his own stem cells to oneself.
Okay.
So there we don't need a donor, though the term can be misleading. Transplant by definition means taking an organ or something from another person and putting it into the patient who's the recipient. But here we have something called autologous bone marrow transplant, where the patient has to donate stem cell to his own self.
Okay.
So there, this is usually done in lymphomas and myelomas. The advantage is that we don't have to really search for donors, which is a major challenge in allogenic bone marrow transplant. For leukemias, unfortunately, there's no role of autologous. So the only transplant that we do is allogenic, where either someone in the family, preferably a sibling, who's fully HLA matched. Like how we check for the blood group, there is something similar called an HLA typing. If the HLA matches, which is usually seen in siblings, then they are the potential donor. In case there's no full matched donor in the family, then we have to resort to matched unrelated donors. We have registries, databases where these HLA values can be put, and within a day or two we get the results. It's like searching for a friend online. So we get to know whether there are any potential donors, and then we take it from there.
So we all know, or most of us know about organ liver transplants or kidney transplants and donors available, or the organ available for that matter. But when we talk about bone marrow, none of us would really know the depth about it.
So it is very different from organ donation. So there's no surgery involved, there's no anesthesia involved, everything is IV. In fact, the donor who is giving the bone marrow stem cells also need not get his bone marrow aspirated. It's from the peripheral blood cells. It's very similar to a blood donation. Yeah.
Really?
Yes.
So what exactly is this bone marrow?
So thanks to certain medicines which helps mobilize the bone marrow stem cells into the blood, these medicines help bring out those stem cells out of the marrow into the blood. So for a donor who wants to donate the bone marrow stem cells, all we need is a peripheral IV line or a central line. And this is the reaction which I get for most of the patients. For a healthy donor who has never been to the hospital, who has never had a prick, asking him to get a bone marrow aspiration biopsy done is too radical.
Yes.
So we don't require it. So all we need is, in fact, it's similar to blood donation. In fact, it's done on the same machine as the blood donation. So if you are probably unaware about it, you might mistake it for a blood donation.
Correct.
Yeah.
That's
so it
true.
takes a little longer. In fact, the side effects that is associated with blood donation is more than what you do with bone marrow donation.
Okay, so we have this camps we do for blood donations. So same way वैसे bone marrow donations के
The problem with bone marrow donation, we cannot have, I mean, that's a far-fetched thing. We can't have bone marrow donation drives, but we can have HLA typing drives where more patients are called in, not patients, sorry, people are called in and voluntarily they are supposed to give the buccal swab or a blood sample to know the HLA type, and this HLA details are then fed into the registry. So that if there's any patient across the globe who requires a bone marrow stem cell, then these voluntary donors can be contacted. So that is possible. Countries like Germany leads it. They organize these HLA typing drives.
Okay.
The challenge in India is that it's very expensive. HLA high resolution HLA typing costs close to 10,000 rupees. Far more expensive than getting a blood group done.
Of course.
So that is a major challenge. But I have patients whose families have voluntarily done their HLA typing.
Correct.
So that if there's anyone else, because they have gone through that, not having a full match donor has made them realize that at least HLA
Correct.
search should be facilitated.
So now I know the importance of becoming a blood donor as well. So you should participate in such camps जहाँ पे ये सब हो रहा है, because it's not going to cost us anything, but then it is definitely going to help some.
So in blood, you lose that blood 200 ml, 250 ml during the blood donation. But in stem cell, it's longer than a usual blood donation. It takes around 6 to 7 hours. And at the end of the 6 to 7 hours, around 100 ml of the stem cell is withdrawn.
Okay.
So that way the patient does not really feel anything. They are much more healthier, much more comfortable than after blood donation.
So after this blood marrow transplant, does patient have to take any extra precautions? Yeah, are there any side effects, or is it that the body will not accept it or something like that?
So prior to the bone marrow transplant, the patient has to undergo high dose chemotherapy. This chemotherapy is more than what we otherwise give for treating the disease. This helps clear the native marrow because there has to be space for the new marrow to come and home and find its place. So this myeloablative conditioning is a very, very toxic chemotherapy, clears up the marrow, and that is the reason why immediate after transplant, the WBCs fall down. WBCs are our immune cells.
Yes.
So when the WBC drops down, the patient's immunity goes down to very, very low levels, and that is the reason these patients have to be kept in an isolation room. Even when we as doctors visit, we have to wash up like how we prepare before a surgery, change into sterile clothes, wear a mask, cap, gloves before attending to these patients, because their immunity is so low that any common infection, bacterial infection or viral infection can be life-threatening. Okay. So these precautions, and this duration lasts for roughly a week or 10 days. And once the donor bone marrow, the stem cells find its home and starts growing, it's like giving seeds into a soil.
Correct.
So once they start generating cells, then the WBC counts come up on its own. And then that risky period is over.
And after the transplant also?
So basic care is taken. They need not spend the recovery phase in a such a sterile unit. We tell them they are free to travel, take public transports, but of course with mask, limit the number of visitors who come, once they get discharged at home to see. It's to be sure that no outside food, whatever is given to the patient should be well cooked. No salad, because salad, raw fruits, vegetables can carry some bacteria which do not go even after washing under running water. So we always advise these patients to consume well cooked food. Okay. They can have whatever they want as long as it's well cooked food. That's not a problem.
And do the doctor decides which patient needs a bone marrow transplant?
Absolutely. Yeah, that's where I come in. So there are indications for bone marrow transplant. The usual dictum is that bone marrow transplant is not directly the treatment of leukemia. A leukemia or lymphoma or myeloma for that matter should first be cleared by the conventional therapy, which is usually chemotherapy or target therapy. And once these patients are disease free, that's when the bone marrow transplant is done. Bone marrow transplant is actually a treatment to prevent the recurrences of these diseases. Okay. As I previously said, that relapse diseases are major concern.
That's what we feel. Like when we talk about cancer, relapse is what everyone fears about. Because at that time, वो time पे तो cancer fight कर लेंगे, but what if it comes again?
So that's where bone marrow transplant comes in. it reduces the chances of the disease coming back.
So what kind of diet or lifestyle modifications you advise to such patients who are taking chemotherapy?
So while on chemotherapy, as mentioned, well cooked, nutritious, balanced food, vegetarian, non-vegetarian really doesn't matter. They need to have multivitamins, calcium supplements, antioxidants during the therapy. We always advise these patients to have their mouth rinsed regularly with a mouthwash,
Okay.
to avoid constipation, because these are the sites
Okay.
where commonly there can be inflammation. Inflammation of the mouth can lead to pain, painful ulcers, oral sores. Similarly, pain while defecating, that is while passing stools,
Okay.
can be very troublesome.
Okay.
So
okay.
I always advise my patients to ensure that it's not just the therapy. Once you receive the therapy and go back home, these are the very, very important, crucial supportive care that is as important, if not more, as the cancer therapy.
Once the patient is completely out of danger and healthy and cancer free, what kind of lifestyle modification the patient should actually follow so that the chances of relapse really go down? Because it's been said that if you don't feed the cancer cells, you can stay cancer free.
Yeah. So for patients who have completed therapy, they're off treatment and on regular follow-up, I think it's the follow-up which is the most important part, because now they're not on any therapy, they're asymptomatic, they have absolutely no symptoms. But these patients should regularly follow up, because the reason why follow-up is important is that if the disease comes back, we won't wait for the disease to start causing
Correct.
symptoms and then treat.
Correct.
As a physician, I'll be able to pick up the disease much more earlier than the patient
True.
start to have symptoms. So that is a very important aspect. And thanks to the advancements, now we have blood tests, we have scans, we have PET scans, which can detect the cancer at a very, very early stage, even at the time of relapse. So, and the rule is that the earlier the stage of cancer, the easier it is to treat it. The intensity of the therapy is lesser if it is diagnosed at an early stage.
Right.
And the number of medicines that are given is also lesser in such patients. So, less side effects, less medicines, better quality of life. All this is possible only if these diseases are diagnosed at an early stage.
That is true, yeah. So we have a segment which is called as what listeners are asking. So I have few questions जो हमारी जनरल पॉपुलेशन या पेशेंट्स अक्सर जानना चाहते हैं या चैट जीपीटी या गूगल करते हैं. So if you can help us with it. So we saw a lot of people asking on social media, especially during this awareness month, that if they have like a bleeding from the gum or if they have little fever, so is it that कि उनको cancer है? Because that bleeding from the gum is a very it's a symptom which says कि ठीक है, there's something wrong going on.
तो मसूड़ों में ब्लीडिंग होना डेफिनेटली इमीडिएट कंसर्न कैंसर नहीं होता है. सबसे पहला तो पुअर ओरल हाइजीन, दवाइयाँ होती हैं जिससे मसूड़ों में सूजन आ सकती है और वो भी ब्लीडिंग कर सकते हैं. प्लेटलेट्स कम होना, हम सुनते हैं कि डेंगू, मलेरिया, वायरल इन्फेक्शंस में प्लेटलेट्स कम हो जाती हैं, तो वो भी एक वजह होती है मसूड़ों से ब्लीडिंग होना. अगर ये सारी बीमारियों को रूल आउट कर लिया है और फिर भी मसूड़ों की ब्लीडिंग कम नहीं हो रही है, तब हमें कैंसर के बारे में सोचना रहता है. Otherwise, mere presence of gum bleeding should not be that
associated
worrisome
with
from
cancer. Okay. Is getting blood cancer common in young people? Like I always thought it was an adult thing, and can it happen to someone of my age too?
So unfortunately, yes, it can. There is no age limit. बच्चों से लेकर न्यूबॉर्न से लेकर एल्डरली तक सबको कैंसर का रिस्क हो सकता है. बट विद एज, जैसे जैसे उम्र बढ़ती है, म्यूटेशंस बढ़ने लगते हैं, द अक्वायर्ड म्यूटेशंस, और इस वजह से कैंसर इज मोर फ्रीक्वेंटली सीन इन एल्डरली.
आई सॉ अ स्टोरी अबाउट डोनेटिंग बोन मैरो टू अ स्ट्रेंजर. हाउ डज दैट प्रोसेस वर्क एंड कैन आई रियली हेल्प समवन?
Yes. So by voluntarily giving your blood or your cheek swab sample to organizations like Be the Donor or Datri, that's DATRI.
Okay.
One can give their HLA information online, and if there's any patient who requires a blood stem cell of the same HLA type, so then वो कई सालों बाद भी हो सकता है, और तब ये ऑर्गेनाइजेशन डोनर को कांटेक्ट करेंगे और फिर हमें उन्हें मिलना रहेगा.
Okay. There are some reels which says कि fatigue and weight loss could be blood cancer. So when should I start worrying and what should I do for that?
तो मैं हमेशा ये कहता हूँ कि कैंसर एक बीमारी का नाम नहीं है. 100 से ज़्यादा बीमारियों को कैंसर बोलते हैं, इसलिए सिम्टम्स एक दो नहीं होती हैं. एनी सिम्टम्स, इवन एसिडिटी, वॉमिटिंग जैसा मतली आना, या कॉन्स्टिपेशन और डायरिया, ये सब कैंसर की निशानियाँ हो सकती हैं. बट ये सिम्टम्स हम सब में होती हैं ऑन अ डेली बेसिस. वी हैव देयर इज नेवर अ वीक वेयर ये सब चीज़ें नहीं होती. ऑफकोर्स इफ़ यू मेंटेन अ वेरी गुड लाइफस्टाइल तब ये नहीं होती हैं. बट जब ये सिम्टम्स रेगुलर इलाज के बाद भी एट द फैमिली फिजिशियन लेवल, एट द MD लेवल, उनके इलाज के बाद भी ठीक नहीं हो रही, जैसे एसिडिटी एंटासिड्स खाने के बाद भी ठीक नहीं हो रही है, तो वो एक इसोफेजियल कैंसर या स्टमक कैंसर का एक अर्ली साइन हो सकता है.
The treatment of the chemo, like it steals everything. I mean, the patient's sleep, some future plans and everything. So how do people manage emotionally while going through the blood cancer treatment?
There are chemotherapy which have lesser side effects. We have medicines where there's no hair loss also, where they can continue their routine day-to-day activity. I have patients who come from work to get their chemotherapy session and then go back and report to work.
Wow.
Yeah. So that is because the chemotherapy का मतलब नहीं है कि ये हमेशा बहुत ही aggressive इलाज होने वाला है. माइल्ड कीमो टैबलेट कीमोथेरेपी भी होती है, ओरल कीमोथेरेपी बोलते हैं उसे. और तो ये दवाइयों से टॉलरेंस बेटर होता है कंपेयर टू द आईवी इंजेक्शंस. फैमिली सपोर्ट इज़ वेरी वेरी इंपॉर्टेंट. सोशल सपोर्ट जो हम बोलते हैं, नॉट जस्ट एट द फैमिली लेवल बट वर्क प्लेस, फ्रेंड्स, ये सपोर्ट सिस्टम अगर होता है तो वी हैव सीन दैट पेशेंट्स टेंड टू कोप बेटर टू द थेरेपी. देयर कंप्लायंस इज बेटर. वो सही टाइम पे ट्रीटमेंट लेते हैं, साइड इफेक्ट्स कम होती हैं, एंड द एंड रिजल्ट इज दैट रिस्पॉन्स रेट्स बेटर होते हैं क्योंकि इलाज सही डोज पे
पॉजिटिवली दे आर अप्रोचिंग इट. सो थैंक्स अ लॉट सर, एंड थैंक्स टू बी ऑन द शो. एंड जैसे मैंने आपने सुना कि you are like everywhere,
yes.
and still you got time for us, so it's an honor. So that's all for today's episode. Remember that early checkups, timely diagnosis and right awareness makes all the difference. So let's stand together to support those who are suffering from blood cancer, support donation drive and support right knowledge so that we can save life. So if you find our videos informative, don't forget to subscribe to our channel and follow us on Instagram at It's One Life by Mankind Specialities. Until then, stay informed, stay healthy.